My name is Miriam Al-Saidi, a second-year medical student at the Elson S. Floyd College of Medicine, presenting the effect of positive end expiratory pressure, known as PEEP, and incidence of post-operative pulmonary complications and hospital mortality in obese patients, systematic review and meta-analysis. The purpose of this project is to determine whether low or high intraoperative PEEP reduces post-operative pulmonary complications in patients with obesity undergoing general endotracheal anesthesia. Physiologically, obese patients have a greater thoracic wall weight, causing decreased lung functional residual capacity and thus have an increased risk for intraoperative atelectasis, which must be considered when administering anesthesia. It has been suggested that high PEEP may improve alveolar collapse and thus atelectasis post-operatively, but it is controversial whether high PEEP is more protective than low PEEP. This flow diagram shows that we searched 4 databases and screened 903 articles and ended up with 4 final studies in our final analysis. And our main inclusion criteria are patients with BMI greater than 30, and the primary outcome was incidence of postoperative pulmonary complications, including atelectasis, acute respiratory distress syndrome, and secondary outcomes are extra pulmonary complications such as intraoperative hypertension and hospital mortality. Our results show that there was not a statistically significant difference between low versus high PEEP for our primary outcome of postoperative pulmonary complications as seen here in Figure 1. As for our secondary outcomes, such as extrapulmonary complications and hospital mortality, were not analyzed because only one trial provided data for these outcomes. And analysis of 3 of the 4 studies for intraoperative hypotension showed a significant difference between the 2 groups seen here in Figure 2, where high PEEP is correlated with higher rates of intraoperative hypotension than low PEEP. In conclusion, there is an overall lack of evidence to determine the risk of postoperative pulmonary complications between low and high PEEP. Our intraoperative hypotension results are consistent with existing literature. And overall, our study demonstrates the need for future trials to assess the safety of low versus high PEEP to establish a standardized protocol for mechanical ventilation in this patient population, who are often at risk for more postoperative pulmonary complications and infection following general endotracheal anesthesia, and as a result is associated with increased medical costs.